Before we leave this topic of nutrition, I want to talk about alcohol consumption, because I know in the state of New York, and I think in nearly every state in the Union, alcohol and substance abuse programs are mandated in the middle schools and high schools in our country, which is a good thing. But I have never heard or seen a program on substance abuse, especially dealing with alcohol, that mentions alcohol as a cancer risk factor. And I'd like you to share with our audience, please, more about that. Does alcohol raise your risk for cancer, and what are your recommendations for alcohol consumption?
Jump to the front on this. Alcohol, again, classified by World Health Organization as a carcinogen, actually a breast carcinogen causing breast cancer, colon cancer, liver cancer, head and neck cancer. We've worked to look at alcohol consumption in adolescents and young adult women and see that the alcohol consumed before a woman has her first baby has a bigger adverse effect on her breast cancer risk through the rest of her premenopausal years compared to alcohol consumed after having babies. And unfortunately, I'll say the women have caught up with the men in college and are now probably out drinking men on some campuses. And the adverse effect, as you say, of this on breast cancer risk is largely unknown in the community. So multiple cancers, known carcinogen, and while a lot of research is ongoing to find what mechanisms or pathways may be responsible, that we could find alternative strategies to counter the effect of alcohol, limiting intake is clearly the best and safest strategy, and most organizations recommend an average of no more than 1 drink a day or 7 drinks a week for women and twice that for men. But really, under 40, there's no public health benefit, and the mortality from traffic accidents and other social impact is heavily against alcohol consumption.
So would it be correct to say that even though the American Cancer Society, if you go online, you'll see they'll say 1 drink per day for women, 2 drinks per day for men, that's assuming an average weight. But there really is no safe limit of alcohol, that no one knows that 1 a day will not harm you. That is completely arbitrary. Is that correct to say?
A cancer point of view, there's no safe limit. The argument for moderate alcohol comes from cardiovascular benefits, but last time I checked, no one's dying from heart disease under age 40. They're dying from motor vehicle accidents and the consequences of intoxication.
Would anyone else? Thank you.
So this, I mean, there's a lot of calories in alcohol, which often
That's
gets.
right.
But there's been a debate in our university that, again, given a lot of people in the audience, and that is that when I was growing up, the drinking age was 18, which meant that when you were in college, it was legal to drink. And that led to the ability to have certain dialogues that now that the drinking age is 21, puts a lot of impediments. And actually, I think it's made binge drinking a lot worse because of you're reporting something that's against the law. So this is something that a lot of colleges and universities are really trying to debate about, whether the raising the drinking age has actually made things more difficult to address the problem of drinking in that vulnerable group. But at the same time, I would also say that the interaction between drinking and smoking is incredibly powerful, and so you've got multiple risky behaviors that are really tough to deal with. But again, the issue on the cancer data it's clear cut. But it's something that, again, as a society, we may have made it more difficult to talk about because of this drinking age issue.
Thank you. Dr. Cohen?
I'll add just one area beyond etiology, meaning that alcohol can be a direct carcinogen and be a risk factor for the development of many cancers, in some sense pulling that trigger on genes. It has also been associated with worse outcomes once somebody is diagnosed with cancer, and in particular breast cancer. So this needs to be part of the treatment plan to advise women who have been diagnosed with breast cancer to limit or ideally avoid all alcohol to improve the probability of lower chance of recurrence of disease and overall longer survival. And this, again, is going to be true for a number of cancers, and it's typically not something that's talked about in the clinic exam room.